I'm Christopher Granger from Duke University here in Barcelona at the European Society of Cardiology, where we're presenting the results of the IMPACT-AF cluster randomized trial. The background for this study is that we know atrial fibrillation is common, 34 million people around the world. About 1 out of 5 strokes is caused by atrial fibrillation, so huge public health concern. We have very effective treatments to prevent stroke, but they're not used very well. In fact, even in high-income countries, only about half of patients with atrial fibrillation and guideline-indicated reasons for anticoagulation are treated, and it's even lower than that in low and middle-income countries. So we took 5 middle-income countries, Argentina, Brazil, India, China, and Romania, and took 50 centers, 10 in each country, and randomized them to either an intervention or control, with the goal being to improve the proportion of patients treated with anticoagulants over a 1-year period. And what we found in this cluster randomized study, including about 2,300 patients in these 50 centers, was that with the intervention there was a 9% absolute greater increase in the use of anticoagulants in the intervention sites compared to the control sites. This was highly statistically significant. And it was accompanied by a 50% reduction in stroke. And in fact, of those patients who were not anticoagulated at baseline, in the intervention sites, about half of them became anticoagulated by 1 year. So this is the first time that such an intervention study in atrial fibrillation has shown this kind of an impact and has shown a reduction in stroke. And we believe that this has very important global implications. It shows that an intervention, and our intervention consisted of those elements which have been proven to be effective in implementation studies. That includes multifaceted education of both healthcare providers and patients, and audit or measurement and feedback, and a multifaceted approach. And that type of an approach then can have really a profound impact on improving the use of evidence-based treatments, in this case for atrial fibrillation, and reducing stroke.